NCPA had two priorities in mind when we began formulating the plans for this forum. First, we wanted to make sure that all the players in healthcare knew that community pharmacy has the capabilities, directly or with partners, to serve their patients who need specialty medications.
I do believe that there is an important role for community pharmacy and specialty. There are differing opinions on this, and you hear, in the environment, some analysts who will say that community pharmacy really needs to kind of focus in on things other than specialty. I don't believe that.
It's not business as usual. It's something that we have to go out and fight for to establish our ability to do or reestablish our ability to do it and do it very effectively.
The opportunity, I think, for community pharmacy is really to define the community pharmacy as the place that patients can go to get better for certain illnesses.
We sat down with an oncologist, and we told him our story and what we were wanting to do, and he looked at us and he said, "You can do this locally." "Yes, sir." "You're sure you can do this locally?" "Yes, sir, we can." Today, that oncologist, when he gets a new patient, he says, "This is your new pharmacy. They will take care of you."
Just because it's an expensive drug, all of a sudden that doesn't change the dynamic of how we deliver patient care services in our pharmacies. But we are continually faced with the situation where that business is being taken away from us.
I heard many times over, our dream was to have a CVS pharmacist, just for sake of example, fill in a prescription, and when they hit enter to send the claim, the screen comes up and says, "I'm sorry, you're not in the network." And they had to come to us.
I think that if there's really one major imperative for the practice of community pharmacy, it is to figure out what the role is going to be over time in delivering and in helping patients manage these medications.
Today, I am competing with the big box. If you go on the Blue Cross Blue Shield of Tennessee website today, I'm the second pharmacy listed in the preferred specialty pharmacy network. I'm competing with all of them. If I've got the drug, I can fill your prescription and I can bill your insurance. And that's cool.
Second, we want to help even more community pharmacies understand what it takes to earn this business and the options that they have for proceeding to do so.
Time is of the essence. If you're going to wait 2 years to build a specialty pharmacy today, you're probably going to be on the outside looking in, because the market is getting more limited and more closed every day.
This is going to be a healthcare system that will increasingly be driven by data. And you see that already, and you see that in the ability of health plans now to start to understand patient experience better, to start to identify patient populations.
They need to get the care at the right time, the right care. They need to be compliant to what their protocols are, what their regimens are. If they're not, that's a problem for them and a problem for the system.
Managing those HIV patients takes a significant amount of time and energy from all of the back end as well as all the patient services, and then doing the marketing.
And all of a sudden, I think we changed the dynamic of whether or not these pharma companies will be interested in allowing independents to participate in their particular product distribution. If we can identify patients for them, help test them to make sure that they're appropriate in terms of their candidacy for a particular therapy, and then deliver on the therapy as well, and assure the adherence and compliance, because we're already doing that, I think, across the board for all of our patients.
It's not any willing provider. It's any willing and able provider. You've got to follow through. You've got to be committed to do it right, because these are very high-cost drugs. These are very sick patients, and they need a lot of care. And they can only get it from independent pharmacy.
Collectively, I applaud you for being here, for exploring this, for participating in it already perhaps, but I think we as a sector of pharmacy, as an industry, need to come together and demonstrate our value, and I think we will win this battle very, very clearly.